Welcome back. With the case numbers continuing to rise, we turn to infectious disease Dr. Zain Chagla with, so much to talk about. Good morning and Happy New Year, by the way.
Happy New Year. I know it seems like decades since this year started.
I was thinking about it during the commercial break. I think, here we are, you and I in another year. I think you are the longest running weekly guest in the history of Morning Live.
Well, hopefully this is the year we get to come in person. Let's
imagine?
Hope, yeah.
Can you imagine if we paid you? Woo-hoo! That many visits? But we certainly appreciate your weekly visits and all the great info. I want to pick up on a tweet of yours. Vaccinated people getting asymptomatic testing over the border is pouring water on the dry grass when the house behind you is on fire. Let's talk about travel testing and what the government should be doing.
Yeah, look, we have testing issues locally. People can't get tests in time. We're going to schools without, rigorous testing. There's a need for testing to go where it's needed, right? And again, are we worried about people coming over the border with COVID? Well, the studies are suggesting 2 to 3%, maybe. And these are people that have a test before they leave. Add to the fact that PCR tests can be positive for a little bit of time. So unfortunately, the people that have COVID right now that can't get a diagnosis may have a positive PCR in a month or two when they go to travel. And so there's a lot of trouble with this testing now, and recognizing that, there's a lot of need for testing locally in our communities across the country. And again, there's probably a discussion to have here to say maybe we should slow border testing and work on making sure that places that need testing where it's going to affect patients get testing.
And with the local testing, should we put more emphasis on the rapid test kits? I know the PCR is the most accurate, but it's that lag time. I know anecdotally there's a long-term care home in the area that have staff that their cases were resolved while waiting for their PCR results to come back.
Yeah, look, this is a disease where it transmits very quickly, right? So the more information you have in the moment, the better, you're going to make decisions. Are rapid tests perfect? No, but a positive rapid test is probably something you can act on pretty quickly. And so, there is a need to deploy it. The province is using these now in schools as a way of trying to get kids back to school with minor symptoms if they have 2 negative rapid tests. So there's going to be a lot of these environments where they can be used a bit more aggressively, especially knowing that PCR tests are hard to come by.
And shouldn't those rapid test kits be as available as coffee stir sticks? We spend so much money on vaccines.
Give them to select populations. I think school kids and school teachers and childcare and daycare are great environments where they're going to help with making sure that people aren't away for a significant amount of time, and we diagnose cases in those settings without necessarily dealing with lags to get tests. So there are places. Is it for everyone that's staying home every day and with minor symptoms? Probably not, but certainly these people have to engage with society that can't access PCRs. It's a good alternative, and again, using them appropriately.
Yeah. Now, what about the reporting, though, and the recent changes and parents not being notified unless there's like a 30% absenteeism rate? What do you think about these changes announced?
Yeah, look, I think more information is better, and at least having a bit more real time. Do I want to know as a parent if my kid's school is 29% absent versus 30% absent? Yeah, I probably can make some decisions on that, especially if I have someone vulnerable living in my household. It might be time to take my kid out of school for a couple of weeks. I think there is a little bit of that. That being said, if we can't diagnose people with PCR, if rapid tests are really the best we can use in schools, and kids, unfortunately, may not even get tested or maybe isolating, with symptoms, we have to use some surrogate measure. And I think, again, the province is trying to breach that to say, okay, here's the information to say there's a lot of activity in school.
Okay, less than 60 seconds left, but there's 2 things I want to hit here. We're hearing about Deltacron. Is it a lab error or is it something to worry about?
Yeah, I think, based on what the virologists are saying, it seems like a lab error that kind of where this falls on the tree of life doesn't really make any sense. And so often, again, if you do the test with contamination, you may get results that look like a single virus that are actually 2.
Okay, we've got enough problems with Omicron right now. And before we go, with Omicron raging the way it is, and our vaccination rate is pretty darn good, I want to ask you quickly about something we haven't talked about in ages, herd immunity. Is that a possibility?
Look, I think, the people that get better from Omicron that have mild outcomes are going to get immunity from it. And that's going to affect, how hospitalizations erupt with the next variant or that type of thing. So we may not get, 0 cases because of this. But I think things become more and more stable over time as again, more people get immunity and more people get their booster shots.
Okay. All right, and we got to go, but thanks again. We really, really appreciate your weekly visits, and it's like we're into a new year, so Happy New Year. We'll see you again next
Happy
week.
New Year.
Zain
Take
Chagla,
care.
thanks for joining us. All right, over to Brian.